When making health policy decisions, we need to take into consideration many complex factors, and it can be challenging to draw all of the available evidence together for an informed decision-making process. For example, it can be difficult to develop prevention strategies when multiple risk factors for a disease interact, and it's hard to estimate the impact of public health interventions when we plan to implement them in combination. Gathering and integrating this information used to be a really formidable task, but thanks to the advances in technology, there are ways to do it now and present it in a clear and really constructive way. So, together with ACT Health, we've created the Healthy Food Intervention Model, something to take the complexity of the world and break it down into a simple, predictive tool to help you improve the health of the population. It's a simulation for testing the impact of health policy on the public, on government, on businesses and organizations like sports clubs, and it comes complete with all of the texture needed to capture both the costs and the benefits for all of these individuals that they have to consider on a day-to-day basis. We start by creating simplified computer representations of individuals, students and adults and sports centers, schools, and anything else you find relevant in the ACT, and we just let them live their lives. Students go to school and adults go to work. They go home, they see advertisements, they travel through the region through bikes or through cars or through public transit. And they even get to participate in a sports event or go to the pool every now and then. From this, we can see that all of these interactions are having an impact on people. Let's take a look at some examples. A school running Fresh Tastes might see kids eating better, reducing their weight over time, and increasing the number of green servings they have every single day. A workplace might partner up with the government to join the Healthier Work program, dropping a donut from its staff canteen and replacing it with something a little lighter. All of these small factors add up, and you can see how they start to make an impact on obesity, overweight, and nutrition levels in the long run, as well as all of the other costs and benefits that are experienced by governments, the health sector, businesses, and even the public when these changes are made. The great thing about the Healthy Food Intervention Model is that we can test not just different types of interventions, but combinations of interventions. So, what happens if we remove junk food advertising at sports stadiums? What if we can remove it everywhere? What would happen if we can get more people actively making healthy choices and demanding healthier items? What if we could do all of these things at exactly the same time? Because we have all of these individual entities in the model, our students, our adults, the venues and the schools, we can see just who benefits and who doesn't when a policy change or an initiative is launched. We don't have to focus just on averages or just on summary statistics anymore. We can take the population and chop it into little pieces, demographic slices, and see how they all benefit or suffer over time. Because all of these entities have a mark in the model, and it's provided by all of those stakeholders who have their different viewpoints on how the world works, it allows all of those groups to come to the table and negotiate over a common set of results that they helped build. With the Healthy Food Intervention Model, we help you find the insights needed to better craft policies and initiatives. And with those new ideas, we can find a way to improve the health of the population, discover who our ideas benefit and who they need to serve better. We can build initiatives that give strong results while minimizing cost, and we can better the lives of everyone in the ACT.